Welcome to CIHT Podcasts.
Air pollution kills an estimated 7 million people worldwide every year. World Health Organization data shows that 9 out of 10 people breathe air that exceeds WHO guideline limits. And UK air pollution is linked to 40,000 early deaths a year. Welcome to today's CIHT podcast. I'm your host, Justin Ward, and today's podcast is in support of the International Day of Clean Air for Blue Skies. We will be exploring the links between air pollution and transport. And I'm delighted to be joined by two experts who are both passionate about how we can improve the air that we breathe. Andrea Lee, Campaigns and Policy Manager for Clean Air at Client Earth, and Dr. Suzanne Bartington from the University of Birmingham, who is a Clinical Research Fellow in Environmental Health and Honorary Consultant in Public Health. In 2013, Ella Addo-Kissi-Deborah died at the age of 9. In the Coroner, Philip Barlow's report, he highlighted the medical cause of death as acute respiratory failure, severe asthma, and air pollution exposure. Ella is the first person in the UK to have air pollution listed as the cause of death on their death certificate, and we will explore the implications of this in today's episode. So we know that air pollution affects human health, but more precisely, how does it do that? Suzanne, perhaps if you could pick that up first.
Yes, and I think the tragic case of Ella Addo-Kissi-Deborah really sort of crystallises that effect, particularly putting a name and a face to an individual, because we often talk about numbers in terms of air pollution and health, and actually that's quite difficult to relate to, those roughly 40,000 early deaths a year. I mean, what does that actually mean? And I think the case of Ella very tragically puts that right at the forefront and in the public gaze. When we think about air quality and health, it really affects us all, right from even before we're born, all the way through our lives to later life into old age. So it's something which is very much universal, though of course it will affect some people more than others. And very sadly, it is those who are most vulnerable who are also affected the most by poor air quality. In terms of the actual health impacts, there's both short-term changes. So we talk about key pollutants such as particulate matter and nitrogen dioxide, both of which are respiratory irritants. And then we talk about longer term health impacts. This is long-term exposure over many months and many years. And we know that air pollution exposure reduces life expectancy. That's mainly due to chronic cardiovascular and respiratory diseases such as asthma, chronic obstructive pulmonary disease, coronary heart disease, stroke, lung cancer. So those diseases we know. There are many more which we're still learning about, such as metabolic diseases, diabetes, even mental health impact and cognitive effects, because air pollution also affects the brain. So it's a whole systems impact that poor air quality has, and it's right the way through the human life.
And what's the scale of this in the UK? How many, there's obviously, I mentioned the WHO limits, the sort of limits that are the kind of tolerably sort of safe, I sort of would guess, but how many people in the UK are in areas where those limits are kind of being exceeded, that people have been exposed to really kind of harmful air? Andrea, do you know the sort of scale of it?
It's good to sort of distinguish between the different numbers that are thrown around in terms of the guidelines and the legal limits. So we obviously have in the UK legal limits. Client Earth talks a lot about the need to make sure that we urgently meet legal limits for nitrogen dioxide, which has still not being met across the UK. And those are legal limits that have been set originally through the EU, through its Ambient Air Quality Directive, and have been adopted into domestic law in the UK. Also, in terms of the legal limits for nitrogen dioxide, we're still obviously breaching those rights across the country. And the latest data that we have from the UK government shows that 75% of UK reporting zones, so that across the UK, are still breaching legal limits for nitrogen dioxide 10 years on from when they should have been met. As Suzanne mentioned, one of the pollutants that we're also very concerned about is particulate matter, and especially fine particulate matter, PM2.5. whilst we don't meet the legal limits for nitrogen dioxide, we do currently meet the legal limits for fine particulate matter. That sounds good and positive, but unfortunately, those legal limits for fine particulate matter are currently twice as high as what the World Health Organization itself recommends in its air quality guidelines. So back in 2005, the WHO recommended different levels of concentrations that national governments and cities should be working towards to try and maximise the health benefit of reducing air pollution. And they recommended that we should achieve in as an annual mean 10 micrograms per cubic meter for fine particulate matter. But currently the legal limit for in the UK allows for up to 20 micrograms per cubic meter. So there's a long way to go for the UK to commit to more robust targets, and that's what we're hoping to see in the Environment Bill. So there's still a very serious problem with nitrogen dioxide and also a serious problem with fine particulate matter that needs to be dealt with quickly. In terms of how many people are affected, I think there's still a lot of estimates around, but a recent study that was published estimates that up to about half of the UK population could be living in areas that are still over the WHO guidelines for fine particulate matter. So it's quite a very serious and pervasive problem right across the country.
And is it worth people might think of air pollution as a kind of singular uniform thing, but it's obviously made up of these different gases and particulates. Is it worth just explaining to people a little bit more about what's comprised of air pollution? What are the constituent parts of it? Suzanne, perhaps, do you want to sort of elaborate just a bit on that? We heard some of the terms, but just a little bit more detail, maybe what the sources of those are.
Yes, I mean, there's a whole range of different pollutants in the air. The ones we focus upon really from a health perspective are PM, so particulate matter, and nitrogen dioxide as well. They're not the only pollutants. There's also, historically, sulfur dioxide. It's much less of an issue in the UK. Ammonia, particularly if we're thinking about rural areas. Ozone, which is, again, something which is associated with the warmer summer months. Carbon monoxide, as well as other volatile organic compounds. So there's a whole range, but we very much tend to focus in our epidemiological and research studies on fine particulate matter because that has the most consistent evidence for the adverse effects upon health. And nitrogen dioxide is of interest also from the health side, as well as being a primary focus for legal compliance and the focus of many current air quality interventions such as clean air zones. I mean, of course, it gets more complex than that. And I often criticise the air quality world as well for sort of shrouding everything in acronyms and numbers. But really, when we talk about these pollutants, they're either solids or gases. So if we're talking about nitrogen dioxide, that's a gas. It's an oxide, essentially. There's a whole set of nitrogen oxides associated with combustion. So in densely populated urban areas, that will typically be transport sources. And it's a very localized issue when we're talking about nitrogen dioxide. Of course, it's also produced by combustion in industry, but very much when we're talking about personal exposure in the UK, we're thinking about those sort of inner city and urban areas. Particulates are a whole heterogeneous range of solid and liquid particles in the air. So we sort of batch them all together and call them particles, but we measure them by size. As Andrea said, we concentrate on fine particulate matter, that's 2.5 microns and below. We're now able to measure the ultrafine particles, which are 100 nanometers, and they're probably even more harmful for health, but we're only really just beginning to fully understand their health effects. But the finer those particles are, essentially, the more easily they penetrate the deep layers of the lungs, the alveoli, into the circulation and have that harmful effect on the body. So that includes heavy metals, for example. It includes soot particles. It includes those solid particles which come from tire wear and microplastics, which of course are a key focus of interest when we're thinking about other impacts on the environment as well as those liquid particles. And we're really at an early stage with understanding the differences in the way these particles interact with the body. So we put them together and call them particulate matter. And I think just to add as well, we know that there's no safe limit for human health. So although there are these legal limit values and health-based guidelines which are currently being updated by the World Health Organization, we know that there's no safe limit for particulate matter for human health, and hence any reduction is of course a good thing to achieve for human health.
So at the start we mentioned the implications of having a death certificate where air pollution was cited as a cause of death. So that has profound implications, I think. In terms of the Environment Bill going through, what would you both like to see that have in it to kind of address what is obviously still a major problem?
So I guess I would highlight that in the coroner's findings and the report that was published at the end of last year, the coroner made a point of saying that it was both the illegal levels of air pollution, referring to nitrogen dioxide, and also the levels above World Health Organization for fine particulate matter that contributed to Ella's death. Following that, he has since published also a prevention of future deaths report, which made recommendations to the government and other public bodies, including health bodies and associations, on what they can do to try and address some of the issues that were being brought up in the inquest. And the first recommendation that the coroner made was to say that the government should be adopting World Health Organization guideline levels for fine particulate matter as a legal target. And that is something that we, alongside many others, including our partners in the Healthy Air campaign, also many local leaders and regional leaders and politicians from across the parties and the public as well, have been calling for a number of years now. I think people sometimes think of the work that sometimes it kind of is us trying to get legal compliance for nitrogen dioxide as maybe being a sort of obsession with meeting numbers and ticking boxes. But the reason that we're pushing for compliance with these legal limits is because they will drive action that will reduce air pollution, that will protect people's health. And so, as has already been explained, our legal limits for fine particulate matter are not strong enough, they're not robust enough. And we have seen very little action over the years from the UK government to address this pollutant. So it's very obvious to us and to many others that they need to be committing legally to meet this World Health Organization guideline levels and strive to go further. As Suzanne's already said, there's no safe level for this pollutant. We need to be putting in a framework that drives to reducing air pollution as much as possible. So, we agree that the Environment Bill is an opportunity for the government to make this commitment, to show that it really understands that it needs to be protecting people's health from this, and to be setting the target to meet it by 2030 at the latest. So not just waiting until 2030, but doing everything it can, because some places are close to it, some places already meet it, but there are plenty of areas across the UK which do not meet it, and they need action at national and a local level to make sure that people's health is protected.
And there are a couple of other areas in the Environment Bill that we certainly have been pressing for, certainly some tighter wording around, particularly on local air quality management. So very much historically, this has of course fallen to local authorities. Now there's an emphasis upon partnership working in the Environment Bill, which is very welcome. However, there is still the possibility for partners to refuse that request to participate in air quality management if considered unreasonable, which of course could have an impact upon the ability of local authorities in their endeavours to manage local air quality. So we've been pressing for that to be strengthened, such that there is actually a robust mechanism for partnership arrangements, particularly when we're talking about particulate matter. It's very difficult for local authorities. They're certainly not the only source of emissions. They need to be working on a partnership level with businesses, with industry, with the public sector as well, with local employers. So we're very keen that is strengthened, and also around the regulatory elements, the Office for Environmental Protection, as that there have been some concerns about the regulatory functions, and we just want to be sure that robust mechanisms are in place for. We want to strengthen environmental law rather than weaken it with the Environment Bill, and that is a fundamental principle, of course, to leave the environment in a better place, which we want to be fully reflected in the bill itself.
And one thing we saw during COVID is traffic levels being reduced quite significantly, obviously during lockdown last year when about a third of the world's population was in lockdown. And it was sort of quite high levels in the UK in terms of reductions in air pollution. Suzanne, I know you're working with the sort of COVID recovery work by the Department for Transport. What's the issues with air pollution in that? What do you hope to see achieved out of that work?
2020 was a really fascinating natural experiment in terms of air quality. Of course, also huge changes and huge societal changes in travel behaviours as a result of the emergency health protection measures for the COVID pandemic. What has been interesting, although initially many studies were reporting quite substantive reductions in nitrogen dioxide, particularly at roadside in UK cities and indeed globally using satellite data as well. More recent work that has sort of undertaken de-weathering analysis, and this is another issue, of course, air quality is never straightforward. There's a whole set of other factors involved, meteorology being a key aspect. And more recent work that has, including work at the University of Birmingham, that has undertaken de-weathering, as we call it, which essentially takes out the effect of weather and looks at actually what were the emissions changes attributable to the changes that occurred as a result of the pandemic. And that actually has shown a much lesser reduction. And in fact, it's even in particulate matter, there was very, very little change during both of the lockdown periods. Nitrogen dioxide did reduce at roadside, particularly in the first lockdown, though not as great a magnitude as one would expect with the traffic reduction. So that in itself is a really important learning point. And I think we've learned from that we need to go further than just removing traffic from urban areas. That is very, very important in its own right, of course, and has other wider public health benefits as well. But we need to go further, particularly when we're thinking about particulates and the sources of particulates. For example, domestic and commercial heating. People were spending more time at home during lockdown, often with their gas boilers on. And of course, when we're thinking about carbon mitigation, domestic heating is absolutely critical as a sector when we're thinking about retrofitting as well. So important learning points. The other element that came out of the lockdown period was actually an increase in ozone, which is a potential impact as we reduce nitrogen dioxide, that ozone will increase. And I think it's just important to think about some of these unintended consequences further down the line of particularly focusing on one pollutant tends to then generate another issue. We really need to take a very holistic approach and a much greater focus upon particles, because, as I said, that was the area we didn't see such a reduction in. If we're thinking longer term about transport, then I think a public health focused approach is very important. We've been doing a piece of work with the Department for Transport on the COVID carbon clean air trilemma, because all of these are pulling in slightly different directions in some regards, and not everything which is positive for decarbonisation is necessarily going to deliver direct clean air benefits, particularly if we think about non-exhaust emissions, for example. And similarly, the changes we've seen in public transport usage, which sadly makes many services less viable, and people have been somewhat reluctant to return to public transport, and we've seen something of a rebound in passenger vehicle numbers more recently. So it gives us it gave us an opportunity to understand what the landscape could be like and to think about how do we harness those benefits, but we need the right policies in place in order to make the recovery such that it does benefit both carbon reduction and clean air as well.
And I would say, I guess, from our point of view, it has been disappointing to see, for example, some local leaders over the past few years, especially some of those local authorities that were mandated by the UK government to take action on illegal levels of nitrogen dioxide, and had been proposing things like clean air zones after a substantial analysis that showed that they needed clean air zones to help meet legal limits of air pollution. We saw some local leaders, unfortunately, in places like Bristol and Greater Manchester and other cities, which were kind of using the sort of the impact of COVID and the temporary changes to traffic and people's behaviour to try and further delay already the plans that they were supposed to be putting in place already, which was very disappointing, because I obviously, yes, nobody knows really how we are going to settle back into life after COVID. But as Suzanne's mentioned before, if we take scientific principles like the precautionary principle, we know that vehicle emissions damage people's health. And so, whilst we don't know how many vehicles are going to return to the road, though as Suzanne mentioned, we've seen in many cases traffic levels bounce back to pre-COVID levels. We can't afford to not put the infrastructure in place to continue those efforts that were being made before COVID, with clean air zones, with investment in public transport, with investment in walking and cycling infrastructure, to make sure that, when we bounce back, we don't bounce back in the bad way. We, continue the efforts, and we learn how important it is to protect people's health, and do so in, a coordinated and sensible way. So luckily there's some movement starting back up again in those areas, but we have been disappointed to see how some cities have just ended up delaying their plans even further when they should have been implemented quite a few years ago.
So that's interesting. You mentioned clean air zones. They're seen as, I think, if I'm correct, they're the most effective mechanism for improving the air quality in an area in terms of one of the policy mechanisms. So where have areas been successful? Where have you seen good progress being made, Andrea?
Yeah, so obviously there's no silver bullet, and a lot of policies have to be done together, but the research has pointed to clean air zones being a real keystone policy that would help to drive and take those most polluting vehicles out of the most polluted parts of our towns and cities. We've had the ultra low emission zone in central London since 2019. The analysis from the before COVID has shown that there's been great improvements in emissions reductions and air quality in the zone due to the ultra low emission zone being in place. And we're looking forward to actually that being expanded in October to cover a greater chunk of Greater London. Not all of it, unfortunately. We would like to see the whole of Greater London being protected by this, but at the moment the plan is to extend that ultra low emission zone to the North and South Circulars. And also outside of London, we've finally seen some local authorities taking forward their plans, and we had Bath launch the first clean air zone outside of London in March, and Birmingham also launching their clean air zone in June. And so, these zones, it's very early to tell, and obviously there's a lot of factors from COVID travel that are making the analysis even harder. But given the experience in London and the experience of low emission zones in other countries in Europe, for example, I think we have seen some real positive steps in the UK for, tackling nitrogen dioxide pollution and protecting people's health at that local level, which has been great to see.
It feels that there's a lot that should and has to be done, but and obviously if it's not done, I'm sure Client Earth will make sure that the public has their support in terms of holding the government to task. But where do you see national policy sit within this then, in terms of what the government needs to do?
Yeah, so what we've seen for now really is the government take the approach of really passing down the buck to local authorities to take care of local problems, when really air pollution is a national problem. So obviously it's great to see local authorities implement clean air zones and other measures, but really there's a lot of national policies that are driving the problem and a lot of national policies that are needed to tackle the problem. And unfortunately, that's where we don't think that the UK government has been doing enough either. I mean, earlier this year, we saw the government reducing the grants that it was providing to people and businesses to buy electric vehicles. They're obviously not the sole solution to the problem, but they're part of it. And, we need to see the government providing a lot more support for people and businesses, especially people on low incomes, small businesses, to be able to access, cleaner vehicles, but also cleaner forms of transport. And also more robust measures to tackle other sources of air pollution. So we've already mentioned things like domestic heating. Wood burning is an increasing problem. The government's approach at the moment has been to try and restrict the sale of wet wood. But, its own research that it's commissioned is showing that a lot of places in urban areas, wood burning is a luxury activity. And so, we know from people contacting us how these sort of pollution sources are affecting their everyday lives. And we think that the government could be doing more to tell people how things like wood burning are affecting their health and that of their neighbours, and do a lot more to regulate it and make sure that it's not really causing people harm. And another area obviously also is agriculture, which is a big source, or the main source, of ammonia emissions, which contributes to the formation of fine particulate matter. And there are lots of things that could be done to support farmers, to control things like manure piles and slurry pits, and how they could more efficiently distribute manure and fertilizers when they have to. So these solutions already exist. A lot of the things that we need to get done already are there, but they need to be driven by national policy, a coordinated approach, and not just left to local authorities to pick up the pieces here and there, and for individuals to take on responsibility for something that really the UK government needs to be driving.
One thing we've heard throughout the COVID pandemic is we're following the science. So in terms of air pollution, where's the science going? What research are you involved with, Suzanne? Perhaps as a concluding question, where's the emerging research? You alluded to it a bit at the start about how the effects of air pollution on human health are profound, but perhaps it'd be useful to hear kind of some of the where the horizons are on research and what's going on.
So we're increasingly using big data and data linkage. So really being able to link up information about where people live, where they spend their time, with increasingly granular information about local air quality. And indeed in the West Midlands, we now have that right down to 10 square metres. That, of course, enables us to undertake far more detailed epidemiological analysis. Until now, we've really used a sort of one-size-fits-all approach when we're talking about the impacts of air quality upon health. But what we really want to understand now is how do these effects, how are they carved out by different population groups? So what is your increased risk, for example, if you're a pregnant woman versus if you're a 40 to 50-year-old male? What are the differences? So where should we be targeting our measures in order to protect the most vulnerable? We're particularly interested in emerging pollutants. I mentioned non-exhaust emissions earlier, and we know with this whole transition towards reducing what we call tailpipe emissions that come out of the vehicle exhaust and moving towards increasing number of electric and potentially autonomous vehicles, that the pollutants that come from tyre and brake wear and road dust resuspension are going to become increasingly important. And we're still at an early stage of really understanding what impact they have on human health, and something we are working on at the University of Birmingham is looking at those plastic or microplastic tiny particles of tyre wear, which we know are ingested, which we know can be visualized in lung tissue. We don't really yet know what the long-term consequences of those are, and that really is an emerging area at the cutting edge of research. Ultrafine particles at 100 nanometers or below. Again, we don't regulate those in the UK in terms of across our towns and cities, but we know they're harmful for health, and they probably are the part of particulate matter that is the most harmful, but we're really only beginning to understand the differences between what's caused by ultrafines versus what's caused by the fine particulate matter or larger particles, and also now drilling down to days and hours even. So being able to understand, for example, we look at out of hospital cardiac arrest data to see what time of day did people have a cardiac arrest, and we're able to look at that in relation to the most recent air pollution episode and really understand these changes that can happen within hours of increased air pollutant exposure. So that's just a few of the areas that we are looking at. It's very, very multidisciplinary, which I think is a strength of air quality research, and I think it needs to be. We need to have social scientists, we need to have those who understand engineering to deliver solutions, we need to have people who understand behaviour, we need to have epidemiologists like myself who look at health statistics, and we need to work very much with policymakers as well to ensure that our work is relevant and is timely, particularly in this year of COP26, when we're seeing a whole set of policies being announced. We need to make sure we're ready with the answers to the questions.
Well, thank you very much for both your time. That was Andrea Lee from Client Earth and Dr. Suzanne Bartington from University of Birmingham.